Thank you so much, Tracy and Kate. Thank you for having us. I'm Mollie Forrester from the University of Washington Department of Psychiatry. I have some slides to share. Great. Can everyone see that?
Yes.
Great. Okay. So again, I'm here with my colleague, Dr. Ryan Kimmel, who is our medical director for the psychiatry consultation line. And Dr. Kimmel, please chime in if I forget anything as I go through our slides. But we're here today to talk
And
about, oh, go ahead.
folks can chime in with questions too.
Yeah.
It's we're very casual.
Yes, right, exactly. Thank you. So we are here to share information and make sure folks are aware of the resource that we have in the UW Psychiatry consultation line. And some of you may have heard of the program, some of you may not have, but the PCL is a free provider-to-provider psychiatric consultation service run out of our department, the University of Washington Department of Psychiatry, and it is for any healthcare provider in Washington State caring for adult patients, and it gives you access to consult directly with a UW faculty psychiatrist about your adult patients and any kind of mental health or substance use disorder care questions you might have. The program was started because we know that in Washington State, almost half of all counties here do not have a practicing psychiatrist. And we know that there are lots of wonderful nurse practitioners who have helped fill in that gap, many of whom specialize in psychiatry themselves, but still this means that most patients, most residents of our state do not have access to a psychiatric specialist when they need psychiatric or substance use care. So the state funded this program, making it free to any patient or provider in the state. We are available 24/7 by phone for any prescribing providers to call. And we've got a little slide that I'll show you about how it works, but basically you can pick up the phone any time of the day or night and reach one of our faculty psychiatrists. A couple of years ago, we expanded to be available for non-prescribers to call the line or use the line, and that component of the service is available Monday through Friday, 8 to 5, non-holidays.
To clarify what that means, that doesn't mean that patients can call us. Non-prescribers would be like social workers, psychologists, PAs can prescribe, those kinds of nurses who are help taking care of patients who have behavioral health issues. So
yeah. Thank you, Ryan. So it's anyone in a professional healthcare role with a patient. We try to not limit it to people. So I'm a social worker, tried not to limit it to social workers or psychologists, because we know that even, in many areas of our state, you may not even have that resource. So trying to really make it as accessible as possible. So as I've said, so it's free to the caller and free to the patient since it's funded by the state. Really the kind of the themes of the consultations, because you're talking to psychiatrists, or are that it's questions about assessing a patient, really understanding their diagnosis or what the symptoms might warrant in terms of treatment. Lots of reviews around medication management and recommendations around medications. We are staffed, the providers that you talk to when you call the line are full faculty in our department. They are not trainees or residents. These are our full faculty who really have a lot of different specialties, including several who are addiction board certified. And recently we partnered with the healthcare authority to expand our service to dive a little bit deeper into medications for opiate use disorder. So you'll see what we have on this slide is that our docs, all of our docs, even not just our addiction psychiatrists, have some specialized training in medications for opiate use disorders, and that was in response, to the fentanyl crisis that we know is happening in our state. When you call the line, we will also send you, after the consultation, we will send you a written summary of the consultation. It's de-identified, so it can be emailed. We're happy to fax it. We do have the ability to fax it, but generally we will email that because there's no patient identifiable information in the note. We're not able to review records, and as Ryan said, we can't speak to patients directly. You're welcome to call us more than once about the same patient, however, but those are some of the limitations of the program. Ryan, is there anything else you would add?
That's great.
All right. So pretty kind of straightforward how it works. You basically pick up the phone and call this number. During the weekdays from about 8 a.m. to 7 p.m., we have a mental health navigator staffing the line, and that person will do a brief intake with you, literally about 3 minutes, where they're just getting some demographics about you and some demographics about your patient. Those are required for our funding with the state. And about 80 to 85% of the time, you are directly connected with our psychiatrist. So we try as best we can to make this an on-demand service, given how busy people are caring for patients. And when we're not available on demand, I think our most recent metric was it's about 4 minutes is the average amount of time it takes us to get back to callers. And then, as I said, then we will send you that written summary of the consultation. We aim to send that within a business day so that you can put that in the medical record and refer back to it. We thought we would include a little bit about jails specifically and how correctional facilities are using us. In the original legislation that started the PCL, specifically called out were several practice areas, including county and municipal jails. And since the program started, we've had about 33 consultations from jail providers. That includes Department of Corrections, facilities, because we really haven't denied calls from anywhere. We want to be a resource to really whomever needs us. We had some feedback from folks who've used the line, both prescribers and non-prescribers, that, boy, it'd be really helpful if I just knew kind of what information is most useful when I'm speaking to the psychiatrist. So we created this case presentation outline that's, here's the kind of high level information to have, if you have it, to have handy when you give us a call. This information is also available on our website. So if you want to, share that with your colleagues or refer back to it. And we're also going to be sending these slides to Tracy and Kate so that they can get them out to you all. And then we thought sometimes it could be helpful if we share a case, like a standard kind of case that we get. So I'm going to ask Dr. Kimmel to share this case that we had from a nurse practitioner at a county jail recently.
Yeah, it's a call I took about a female patient in her late 20s with schizophrenia, recently hospitalized on a psych unit, but now in jail, and a poor historian, doing well in terms of side effects, and was given this long-acting antipsychotic. This is a common long-acting antipsychotic. You get the shot in your arm and it lasts for a month with a dose that was increased. And does the next slide have the question, Mollie? If not, I remember what the question was. Yeah, good, good. It's helpful that I took the call. So the question was about this medication called Cogentin, which can be used for specific side effects of antipsychotics. And it was a good question, is if the dose is going to be increased, should I proactively start this second medication to deal with the side effects? And the answer is no, you'd rather the patient be on as few medications as possible. And you're right, this is the medication that would treat those side effects, but there's no need to treat in advance. That most patients don't have those side effects and don't need this medication. An older group of medications, which is what this provider was thinking about, an older group of long-acting injectable antipsychotics routinely required Cogentin. So this is really a question about these kind of more modern meds compared to past meds in terms of the side effects. So that's just kind of an education that we can provide that it helps the patient. And then the provider got a little bit of an update on these medications too. And so the next time they have this question with a patient, whether it's in the jail or their other practices, they'll know the answer.
Thank you. we always take the opportunity when we're given the opportunity to share about the general adult line, the PCL. We like to let folks know too about some of the other similar programs that are run out of our department. And so this slide is about our perinatal equivalent, and this is a resource that's again available to all of you, and it's specifically focused on patients who are pregnant, who are postpartum, who are breastfeeding, planning pregnancy, whatever the situation might be. They really kind of broadly define the perinatal period. But this is staffed by a group of our faculty colleagues who are really remarkable experts in perinatal psychiatry. And they recently added, we have a colleague in the department who is a perinatal psychiatrist, but is also addiction board certified. And so they've recently added the capacity to offer consultations for patients with coexisting or co-occurring mental health and substance use conditions who are also in that perinatal period. And very similar to us, they will consult on a number of topics. They will also do some local resources and referrals, which is a little bit different than our program. And they've also developed what they call a perinatal mental health care guide. And that resource is available on their webpage, which is linked here, and is a wonderful resource that's broken down by, medications that are safe in breastfeeding, psychosis, postpartum psychosis, just a variety of different conditions that may come up in your practice.
Just to add, so that one is only Monday through or on weekdays during business hours. It doesn't have the 24/7 availability like the other one, just because we've managed to cobble enough faculty psychiatrists together to cover the other one 24/7. But there are only 24 truly experts in perinatal psychiatry in the state, and so they work together to provide this kind of daytime availability for that line.
And then again, we like to share about these other programs. So here on the left side, you've got the PCL and then our perinatal PCL. And then there's also a service that probably wouldn't be as relevant for you all, and that's the child line over at Seattle Children's Hospital called PAL, that's noted in the right-hand side on the top. And that is for primary care providers. But really what might be of interest to you all too on this slide is in the lower right, we have this Psychiatry and Addictions Case Conference, and it's an ECHO model. And this is a free educational resource for any provider in our state. They offer, it's every Thursday from 12 to 1:30. They will do a didactic presentation and then some case-based learning, and it's attended by lots of folks from around the state. They offer CMEs or CEUs, continuing education units, for folks who attend, and we always like to promote them. It's a really wonderful educational resource offered here, and another free service, and that's funded by the state.
In terms of educational material, so if you go to our website, the PCL website, you can find newsletters with information and additional learning resources. The perinatal group has developed a whole care guide that's on their website, and that ECHO program, I think they also have recorded didactics on their website. So.
Because one of our big points in being out here is to promote the line and make sure people know about us. This is a picture of some of the swag that I am happy to mail out to you. The goal is to really get the phone number in front of providers so that, when they maybe have a case that they could use a consultation on, they're like, oh, right, I forgot I had this service. And so we've got magnets and squishy stress brains and notepads and pens, and happy to mail those out to anybody who's interested. My contact information is going to be on the last slide, and you all are welcome to reach out. I think Tracy, when Tracy reached out about asking us to do this presentation, we know that a lot of folks still have not heard about us, and so we're really eager to get the word out and share this service with folks. And here's my contact information, and Ryan referenced that we have the website and the newsletter. We try not to spam people with too much. We send information. We send out a newsletter every other month and we try to really focus in on themes that we're hearing about consultation in our consultations with folks. So we get a lot of questions about diagnosing bipolar disorder, and so we will, have an article about that. We did an article about suicide assessment recently, one on medications for opiate use disorder. So trying to keep it really relevant to those of you all out in practice. Yeah, so I think that's everything from us. Are there any questions?
Thank you, Molly. Is there anybody out there, people that are out there from the jails? Do you see how this could be useful for you guys? A couple of months ago, I was at a Washington Association of Sheriffs and Police Chiefs meeting, and there was a legislator that came to the meeting and asked about this program. And I was kind of surprised that only a couple of people had heard of it or even utilized it. And so I thought this would be a good opportunity to share what's available out there. Molly, you mentioned that the legislature made this possible. Can you tell me why they took the time to support something like this? Where did the need come from, or how was that communicated to the legislature?
I mean, I think part of it is that just the lack of psychiatrists in the state, and Children's Hospital has had a line for almost 20 years. And we just know that the majority of the population in our state who have mental health or substance use disorder conditions will never see a specialist. And so this was a way to leverage the expertise we're fortunate enough to have in our department. One psychiatrist can be staffing the line and serve 10, 15 providers statewide in their time covering the line. And so it's trying to really leverage the resource that we have to the most benefit across the state. I'm not exactly sure, honestly, and maybe Dr. Kimmel could chime in about any of this, but why jails were called out. Emergency departments were called out also in the legislation, and some of what we think is because that was because of the boarding. We know that there's just not enough inpatient psychiatric beds, so a lot of patients who are waiting a psych bed are boarding in ERs, and so that was again a group that was called out in the legislation. But we're open to calls from any location.
Yeah, it's not only are there not enough psychiatrists in the state, it's not spread evenly either. That is, there are more psychiatrists per capita in Seattle than there are anywhere else. And so we tend, I guess, not to wander very far from where we graduated residency. And so instead there was this information on where the healthcare is being delivered, or who is delivering healthcare if it's not by psychiatrists. And so it's primary care and emergency departments and jails, whereas the prison system has their own psychiatrists. Jails, at least we've heard, were often covered by primary care doctors or nurse practitioners, primary care nurse practitioners, for example. And so it was called out specifically to be a resource. And we've tried hard to get the word out to jails. It's interesting that how challenging that is, because we get 120 calls a month, and yet we've only gotten 33 in 5 years from jails. And so, and most of the calls have been repeat ones with primary care doctors who have called us once and then call us back several times. So there are a couple of jails actually where we do get repeat calls, only because the providers now know us and then tend to use us. But we're happy to chat. And, if some of you are connected to whoever is providing the medical care at the jails, they're welcome to not only look at our website, they can call us and just find out more about our program. You don't have to have a patient right then and there. If you just want some information, we can give that to you too, or email us.
Someone in the chat asked about if we can help with juvenile populations. We can't. We are adult only, so 18 and older. The program over at Children's, as I was saying, it's only for primary care providers, but Children's has what they refer to as the 777 line, and I think it's because it's got 3 sevens in the number, but that is a resource where if you call that number, they might be able to help you with a psychiatric consultation. It might be worth just calling PAL and asking what they would recommend during their business hours. They're an 8 to 5 program, because I just don't know the scope and if that would really meet your needs, but we are absolutely just adult only. And then Teresa, thank you. Teresa put in the chat about your psych nurse practitioner really knows their stuff, which is always great. And I think that's a good point, is that we get calls from super experienced, like psychiatrists with years of experience who, just every once in a while, it's like, am I doing everything? Like they just want to consult with a colleague. And so being able to reach out and just verify, okay, is there anything I'm missing? And we also get calls from brand new grads, who are nurse practitioners or doctors who are still kind of getting their feet underneath them in their practice. So it really runs the gamut. And there's some really complicated folks out there. And so just being able to kind of pick up the phone and have a colleague right there, we're happy to help anybody.
It can be good for provider morale. It's a tough case. They're making a tough decision. They just want to talk it over with a colleague out loud and make sure that there's nothing else that they thought of and get, someone else saying, yeah, that's be my best guess too. That's a helpful thing so people don't feel like they're out on an island. In terms of Tamara's comment about if the provider isn't able to be contacted, is that the question? I wasn't sure what that question is. Case managers can certainly call us and we can talk about differential diagnosis and kind of general medication things. I wouldn't ever specifically recommend medications unless I was talking to a prescriber, because there's a ton of other medical issues that you have to. So which antipsychotic you choose depends on lots of different medical comorbidities that the patient might have or other circumstances and things like that. But we're able to do lots of education type things.
We've sometimes had non-prescribers call because the provider is busy, like seeing a patient. And so sometimes what will happen is, our docs will say, oh, this is really getting into the medical realm. But that is sometimes something we can navigate with you all. And our docs will be clear of, hey, this is crossing the line. I just really need to talk to the prescribing provider or get some really specific medical information that the caller might not have. I was telling Tracy too, we've learned so much from folks out like you all about, how can we be responsive? What is it that you actually need? I think, the legislators had a great idea and some sense of what the need was, but we've learned a lot and adjusted based on what the feedback we're getting. Like that case presentation summary, that was an idea from a prescriber and some non-prescribers. And we, developed the ability to schedule a consult online ahead of time based on constituent feedback. So we're open to ideas. We'll, can't do them all, but we're always open to them and seeing how we can improve the service for you all. And we're happy to do this presentation for smaller teams or for your specific teams or to other groups that you might be connected with who you think could benefit from hearing about the service. As Ryan said, we have about 120 calls a month. The majority come, like I said, between like 8 a.m. and 7 p.m. But we definitely have some capacity, and so happy to hear from folks and make sure they know about the service.
So Mollie and Dr. Kimmel, a lot of the larger jails contract with medical and behavioral health providers such as NAFCare, WellPath, Comprehensive. Are representatives from these organizations, are they allowed, can they call you and staff cases as well? Even though they have the personnel to make these decisions, maybe it might be a good idea, maybe to staff it with some other professionals.
Yeah, they're stumped. They're welcome to chat with us, or whatever. If they have a question about a medication they've never seen before, or a complication they've never seen before, they're welcome to. Anyone's welcome to call. Any provider is welcome to call.
Yeah, absolutely. And as
Patients
long as
do try and call us periodically, hoping that somehow we have connections to get them into care, but we can't. It's strictly a provider to provider consult line that we're able to staff. Otherwise, we definitely wouldn't have. The psychiatrists wouldn't be able to see actual patients themselves if they were if everyone in the state could call them on these lines. So
Gotcha. Okay, does anybody else have anything for the good of the order? Remember, Mollie and Dr. Kimmel both have extended an invitation to meet with you privately, talk about how they could be of more service to your facility. So if you want to set up a meeting with them, let me know, or I can give you their numbers directly. So feel free to reach out. Thank you for the comments in the chat. Has anybody not had their comment responded to? Okay, all right. Well, I thank everybody for joining us and hope to see you next month on our next event. And so everybody have a good day out there and be safe. See you later.
Thank you.
Thanks a lot.
Bye-bye.